Welcome to another episode of United for a Healthy Stoughton. My name is Stephanie Patton, and I'm the prevention coordinator for the town of Stoughton. And today we're going to focus on staying healthy during COVID-19. And I have two special guests with me here today. I have Janiece Bruce, who is the Director of Public Health and Human Services for the town of Stoughton. And I also have Danielle Gallan, I already made a mistake, who is the Supervisor of Health Services at Stoughton Public Schools. And so today we're going to talk a little bit about really ways people can continue to stay safe and what's happening locally with COVID. One of the reasons that we felt like it was important to do this from a prevention perspective is we really know all these health issues are interconnected: mental health, physical health, spiritual health. And so it's really important for people to really be able to think about health holistically. And we know that there are substance abuse related issues with COVID. We're not going to talk specifically about those today. We are going to just focus on sort of general health and safety for the total population. So welcome to the show, ladies. You guys can unmute.
Thank you. Thank you for having me.
Yeah. So let's talk a little bit about sort of what's been happening in Stoughton. I know, Janiece, you and I were talking about this before the show. Can you give us a little update about what's happening now and how it maybe looks different from where we started?
Right. Well, I want to just say that we're very pleased to see that Stoughton has made a lot of progress, as has Massachusetts. When COVID first hit, our first case was in March. And we were inundated with cases. We were getting 10, 12, 15, 20 a day. Now we're seeing, that was really the height of it, was really in the spring, right around April. And it's dwindled down. As you see, the Massachusetts numbers have come down, and we're really only getting a couple of cases that we're seeing through our database a week. So what happens is if someone goes for a test, we get the results if they're positive, and it gets reported to the state, and the state reports it through each town's database, which is a secure HIPAA database, and we are able to see what the information is. So we're very happy to see that we are holding. I think it's been great having the summer weather. People are out. I think that's helped a lot. People are not in really close proximity. And hopefully the message has gotten through. And I think the messaging from the state has been really good about distancing, wearing masks, all the things that you can do, frequent hand washing, really to keep people mindful. And I think from just my own experience, I feel like people are really putting in efforts to do that.
Great. And can you say a little bit, Janiece, about just in terms of people being in public spaces in Stoughton, what some of the policies and rules are? I know a lot of this has come to us from the state, but just as a reminder to people.
Right. So as you notice, if you go into certain like public places, like say the post office, you have the X's on the floor. People should be staying 6 feet apart. If they're in a space, they should be wearing a mask. Your mask protects me, my mask protects you. So it's really, we're doing it, we're all taking care of each other. So you see a lot of plexiglass. That's I give these people that are at these jobs so much credit because they're dealing every day with the general public. So they're wearing masks, and they also have the barrier of plexiglass. So people really should, when you get back outside, if you have hand sanitizer after being in with touching common surfaces, you might want to, either use your hand sanitizer. I think soap and water is great if you have that available. Really give your hands a nice long scrubbing with soap and water. But, I always carry hand sanitizer. I have one in my car, one in my pocketbook. I make sure everybody in my family has it, available. Now we're seeing, for a while, you couldn't find stuff in stores, but you can pretty much find those kind of items now in your drugstore or your local supermarket or whatever. So I think it's just people being aware and not crowding in against, some people may forget. You see that happen too. People get out of their car and then they have to run back and get their mask. So I think it's just, it's becoming, it doesn't seem so foreign to us anymore. At first it seemed weird, but I think now we're all kind of used to wearing the mask and we're not feeling like conspicuous So, and wash it. If you have a cloth mask that's made, another thing too is wash it, put it in the wash machine, clean it. The little disposable ones are really comfortable if you can find those little surgical masks. Like I have one right here. It's really comfortable. But some people have the home ones that you're buying that cloth ones, so you can wash those. These you can just throw out. So I don't know.
Great. No, that's awesome, Janiece. Let's talk a little bit more about, you actually mentioned a lot of strategies. So maybe Danielle, let's talk in a little more detail about, so Janiece talked about masks. Maybe we can start there. And I know that there are some easy directions or reminders about how we should or should not wear masks. Like this is not, wearing a mask, right? And how to put them on and off properly. Can you take us through that a little bit?
Sure. So I call that a chin warmer, because you see people in the stores and it's okay though. So it's all about education, right? That's our job. So to properly put on a mask, you should never touch the inside of the mask or the outside. So the inside is going to be what's against your face. The outside really is your barrier, right? So that could have a variety of germs on it. So good practice is, and I'm sorry, I'm at home, so I don't have one readily next to me, is to take it off and on by using the straps that go around your ears. Yep. Thank you, my friend.
As a mask.
And if you are to have to take it off and put it down, you can hang it up by a strap if you have a hook, or you should put it the outward face part down, not the part that goes against your face. Mm-hmm. So really what you have coming in contact with your face should remain as clean as possible.
So for us to see you, Janiece, you have to say something.
Oh.
And then maybe
she was doing this fabulous demonstration.
Yeah, say something and then put the mask on.
I've got the mask. I've got it by the strings and I'm putting it on. Okay. And then to take it off, you don't want to be handling the front of it or pulling up and down. You want to take it by the strings. And like, as Danielle said, put it, you don't want to, you want to put it so that you're not getting it contaminated on the surface. Perfect. So right. You can hang it, or I have a little baggie I carry, things in that, and yeah.
Excellent. Anyway. Thank you. All right, great. And let's talk about some of the other things. So hand washing, like some tips around hand washing, and then also, well, let's do that first, and then we'll talk about distancing. So Danielle, you want to take us through hand washing?
Sure. So, I tell everybody, as far as infectious disease and infectious control is concerned, hand washing is a tried and true method that we should all be using. So I have some really good videos. One uses purple paint, and the individual is wearing surgical, actually, I think they're sterile gloves. And they do this demonstration with purple paint and how to actually get every surface of your hands during the 20s. And they say 20 seconds, right, of good hand washing, singing the happy birthday song twice. I'm sure there's like a great Taylor Swift song or snippet that we could probably use with the kids. That would be way more fun than happy birthday at this point, because we've all sung it so many times. But really making sure that it's the friction. And that goes along with hand sanitizer too. So if you are using hand sanitizer instead of soap and water, is making sure that you're getting all of those surfaces on your hands for at least 20 seconds. And that really gets all of the nooks and crannies to be able to get the germs away. But hand washing is best. Soap and water, you just can't beat it.
Excellent. All right. So I brought my prop, but I can't show you, sitting on my computer washing my hands, because that would be probably not good for the computer. And then let's talk about distancing. And actually, one of the things that I learned from some Stoughton Public School students actually is they use the expression octopus arms, right? I guess to help people remember to stay distant. So will you talk a little bit about distancing? Janiece reminded us that when we go into public places, a lot of times we'll see those things on the floor to help keep us as reminders, but sort of when we're not in places that put those things down for us, what are some tips?
So when it comes to transmissibility with this particular virus, it comes down to proximity and time. Proximity is within 6 feet and time is for a period of time greater than 10 to 15 minutes. And so really paying attention to that, along with the good hand washing and mask wearing, I think this is why the state has come as far as it has. As far as that proximity piece, so 6 feet, 2 meters. It's really, if we think about it, like 2 arm lengths away from one another at least, and really creating that space where we're not on top of one another, that we can have great conversations and not be inches from each other's face. And speaking of kids, so we Stoughton did have our Nights of Summer program and our ESY program. So we did welcome back between the two, little less than 300 kids and staff. And it was wonderful. They did fantastic as far as they needed gentle reminders, but they did a great job at creating that space. Sorry, I am at home, so I have children coming. So they did a great job at creating that space and of mask wearing and of hand washing and doing everything that we were expecting, and we were also modeling for them.
Mm-hmm. Great. And actually, I think
and octopus arms was one of those things that I think Miss Feeney came up with as well.
I think that's great. So actually, and that's a good segue to, we wanted to share a little bit about, I know the school reopening plan is very complicated and well thought out, and is not something that we could really explain even in the time remaining in our show. But if you would share a little bit, Danielle, also about, I know you feel really confident about the health and safety of our students with the plans that are in place for the district. So can you speak to that a little bit?
Sure. So we have been working throughout the spring and the summer months on a variety of committees. Steph has been on the wellness committee with me. And so the district has worked as far as operations are concerned, facilities, wellness, instructional, community. I think I have them all. And then there's a steering committee that the chairs report back up to. Oh, and technology. I should never forget Dr. McGee. He's amazing. And so we've been working through these plans as far as how do we educate children? How do we keep them safe in this new environment in a pandemic, and staff safe? And I, as a Stoughton parent, and I think I also have a unique perspective because I've been so involved in this. And so that probably at some points puts me in an unfair advantage, right, as to why I am so comfortable with my children going back to school. But I can confidently say that the district has done an incredible job to ensure that we're following CDC, DESE, and Department of Public Health guidelines, working very closely with Janiece, who has just been a tremendous support to me and the schools, and to ensure that we can have that safe return to school. Great.
So let's maybe Janiece. So I know that both you and Danielle have been working together since this started, and probably before that. But can you share a little bit about how the town and the school really are communicating to make sure the safety of the all of the community, not just the kids in school, are you guys are connecting around that?
Yeah. So I think right off from when we first started. Right off the bat, our town manager and Dr. Robin Grimm and Dr. Marcus, we formed a committee right off the bat. And this is when we were not socially distancing. This is when we were able to meet actually in person before things got really hot. Like we were meeting and we were coming, I think everybody was trying to wrap their head around what was happening as we were seeing the numbers increase. And we formulated plans. And of course, as the situation evolved, our plans evolved as well. So as I know, just talking about the summer camps, I worked a lot with Danielle, about her Nights of Summer and how they could safely do it. We went over regulations. I worked with the rec department. As you know, Matt Cauchon has won a run a wonderful camp program this summer with the South School, and I've gone up there to visit, and it's awesome seeing the kids having a great time. They're actually getting to be with their friends. They're maintaining distance. When they're not able to distance, they put their masks on. It's been great seeing them. They've had a blast. But the town has been very mindful. We're working with the Board of Health. They're going over regulations. We get a lot of complaints. People out in the town, if they see something that they don't think is right, people aren't following regulations, they express concerns, and the Board of Health follows up. Like if it's a business that they feel may not even have the, maybe we always want to give them the benefit of the doubt to say, do they not understand how they can improve things? Do they not understand the regulations? First, we tried to go that route to try to, explain things, what they should be doing. Most people are understanding it now. In the town hall, our town manager, Robin Grimm, has put into place some very strict protocols as far as with the Board of Health and how we're running this town hall. As you know, I know it's difficult for people because we're by appointments only, but it all is the priority of keeping people healthy. I am very involved with the Council on Aging. That's also been closed to the public, but we still are doing rides to the grocery store. We're still delivering Meals on Wheels. We're doing it in a safe manner with people following all the practices of hygiene and distancing. So it's just everybody getting used to things in a different way. But we've all worked together with the schools, with the different departments, just trying to make sure that we're doing things as best we can. And if we're not, we're constantly changing it up to say, how can we do this better? So it's kind of always an evolving situation. So as you can see, we're kind of fluid and trying to adjust. And I know school is going to be another big adjustment. We do know that it's people are nervous and anxious. I'm sure Danielle hears more about that than I do. That's her area. But Danielle's been awesome. She came when we were in the thick of things. She came over to give me a hand with calling, contact tracing, and all of that when we had a lot of people that were sick. So. It's like Stephanie, your show says it, you are united.
Excellent. Thanks, Janiece. So I think it would be also great for us to talk a little bit about, so those are some of the precaution things, but I think what we also don't want to forget, we said at the top of the show, we were talking about sort of health being holistic and some of the other things people really can be doing to take care of themselves, not just now, but always. And so I'm wondering if either of you want to share some other just good wellness strategies that people can be doing now and hopefully continue to do, both before and after all of this craziness. Yeah.
So for me, I feel that trying to find space to unplug is important. Trying to look and find the positive of working from home. Getting to spend more time with my kids, being able to find joy in the simple things in life, but also having some self-reflection and realizing, we had talked about this earlier in our wellness committee meeting, Steph, about how as parents, we need to be very mindful of the conversations and how we're saying them in front of our kids, where we're all a little bit stressed out right now and trying to figure out how work is going to be balanced with school and how we're going to do it where the kids hear us and we don't want them to feed off of that anxiety. And so whatever happens, know that the schools in the town have supports in place and resources in place. And are here, to help in any way that we can. But also we just need to be mindful because just anxiety and fear are quite infectious, but so is hope and resilience. And we really need to choose what we're going to spread in our community.
Mm-hmm. Great. That's excellent. And so I always think about too, what are some of the things we can do for ourselves to help keep our spirits up. And so for me, and I know it's different for different people, I think about like, how am I moving my body every day? What are the things that I'm eating, right? And am I eating things that are going to help me to feel better and good and sharp, or am I, putting things in my system that are going to make me feel kind of like, 10 minutes later, that was delicious, but I really shouldn't have eaten that. And also this, the connection to mindfulness, or how people do decompress. Does one of you want to talk a little bit about some of those, some of the other ways we can just take care of ourselves during this time, both physically and emotionally?
Well, I guess I'll speak to that a little bit. So I think for a lot of people, they feel displaced right now. So I think it's trying to find some purpose in your life for whatever it is. It might be help. It might be that you have time now to look in on other people safely. I think we have to be more of a community, because isolation is depressing and connection feels good. So I agree with Danielle and you also, Stephanie, that for our own personal well-being, I like to get out in nature. I just enjoy my yard, the birds, that to me is very relaxing. I feel like it nourishes me, but I also feel like I'm lucky in the fact that I haven't had my purpose like taken away. Some people are out of work. They feel a sense of displacement. So if you can get connected in a way that with other people are helping, I feel that that's really good for people too. And there are opportunities out there, even if it's like making calls, checking in on people. I know like there's a lot of seniors right now that feel very isolated. Kids that normally play with their friends have felt displaced. So I feel like if we can just try to involve in just some sort of connection, and of course, sleep, I think stress is very tiring. I think, getting adequate amounts of sleep, like you say, Stephanie, a lot of people are home. So maybe they're not eating as healthy. They're snacking maybe more than they would, or maybe having having an extra glass of wine or whatever might make you more tired. But I think it's just being mindful about taking care of your body and also finding purpose of, and it might be a different way. It might be connecting up with people in a different way, but just if anyone has any thoughts on it, that they can always call me. I know right now even our volunteers can't be in person, but we have things. I know we're looking for Meals on Wheels drivers if people are looking for an activity to do. We've got people that could use a wellness check call. So just things like that.
Great. Yeah. And I think it's important too when, we often use that term social distancing, but really we're talking about being physically distant from people. And that connection piece is so important. And so, being able to, I think Danielle talked about earlier, being able to have that interaction, we can still have great interactions with people personally and still be safe by thinking about creating that space and, and wearing masks when we need to and those pieces. The other thing I wanted to ask you both about, which is another wellness thing, and I know there's been some stuff in the news about this recently, are flu shots. Can we take a minute to talk about flu shots and why that's important for people? Yeah.
Yes. So I am starting to get the calls at the public health office about flu shots. We are going to run flu clinics. They're really suggesting to get the seasonal flu shot this year for people that don't normally get it. It's just one less complication for the winter months. And I think that nobody wants to feel like they've got the flu and worrying about contracting COVID. So I know there's a lot of places that give vaccines, your doctor's office, some of the local pharmacies. Our clinics are probably going to start up in September. So we do adults. I know Danielle can talk more to the children's getting their flu shots, but they are recommending people get the seasonal flu vaccine this year.
Great. Danielle, do you want to jump in on that?
Sure. So I'm sure everyone's seen on the news that the Department of Public Health and the School Health Unit in Massachusetts has now made flu shots mandatory for children in primary and secondary school, and also in college and post-primary. And so we had already set up a flu clinic, actually two, one that's happening next Friday on the 28th. It's from 8 to noon, and it's at the Daw School, which is 131 Pine Street, and it's ages 9 and up. And this is open to whomever would like to come. You can sign up online. Our media specialist, Jean Ostrom, is posting on both Facebook and Instagram and Twitter, and then the following Friday as well. So on September 4th, same place, same time frame. Everybody can sign up online. And depending on where we're at, we'll continue to host those. And we work closely with Janiece for the 18 and over group as well.
Great. Thank you. Great. I know that was sort of a timely, like something that people are starting to talk about this week. So we are coming to the close of our show. Hopefully that went fast for you guys too. And so I just wanted to give you an opportunity to add any last thoughts, and then let's make sure we also share. I know both of you have resources. The Oasis Facebook page maintains lots of resources for folks, which is just www.stoughtonoasis.org. And I would encourage people to view that, but I want to give both Janiece and Danielle a chance to throw in any last bits here in our last minute. Go ahead, Janiece.
Okay. So just to let people know that we're here. If you have any questions, call the Stoughton Public Health Office. That's where I am full time. And our number is 781-344-7011. If with any questions, we'd be glad to help you.
Great, thanks. And Danielle?
Yes, so any questions or concerns in regards to your particular family's needs or vaccines, you can contact your district school nurse. We are just really excited to be able to see kids again and have the opportunity to do what we do, and that's educate well children. And if anyone is not feeling well, just know that the right thing to do is to stay home.
Great. Thanks, Danielle. So I want to thank both of you for coming on the show today. And I do want to let our viewers at home know that we're going to do kind of a part 2 to this around going back to school, and some families are feeling anxiety around that. And so we're going to talk about some best practices related to that and some of the feelings and concerns people have with that as well. So keep your eyes open for that episode coming really soon. Thank you, Danielle and Janiece, for being on the show. I really appreciate it. And I hope everybody has a great day. Stay well, everyone.
Thanks, Steph. Thanks, Janiece.